more than 100,000 people in America died of drug overdoses in 1 year, from May 2020 to April of 2021. That is the highest yearly death toll from drugs ever recorded in the U.S. Let that sink in. It is also a 30% jump year to year, according to the Centers for Disease Control and Prevention. Experts believe top drivers are the growing presence of fentanyl and also the pandemic, of course, which left many people socially isolated and unable to get treatment or support. And for those who do seek treatment for addiction, it can be hard to find equal access. Several groups, for example, in South Florida, though, they're working together to not only address the rampant drug addiction problem in our country, but also the lack of diversity and accessibility of treatment. Reporter Tori Dunnan explains how these groups are making a big difference.
For Kevin Choi, the pathway here to change is a long, dark one.
My parents they stopped recognizing their kid, and I would stop recognizing myself, I had burned pretty much every single bridge I could.
His story of opioid addiction.
Finally got injured playing football, broke my elbow, got some prescription painkillers, and it just kind of stayed with me.
Is far too common these days.
I grew up in a very traditional Korean home. This kind of stuff doesn't exist in our realm of family. I think for them it was like, we raised you in church, we raised you in a really good school system.
A cry for help in a Google search landed the California kid in Florida.
Peak of drug use to the pit of drug use took about 7 years.
But what happened next would change his future even more. When you went into treatment, you looked around, and what happened?
Nobody looked like me. That was another barrier that I didn't think about, but it was like, here's a Korean-American kid in Boynton Beach, Florida, in rehab, with faces that don't look like him, with people that may not understand my family structure, may not understand my culture.
That experience put Choi on the map many years later.
Yo.
Now the founder of the Harm Reduction Center in Boynton Beach.
There are other communities and pockets of people that have the same type of experiences and same barriers that I had. It may not be the fact that they're Asian Americans. It could be that, they're Haitian Americans.
A drive and focus to provide accessibility for all. He just did a microscopic study of his facility.
This is another waiting room that we have. On our commercial basis, I would say less than 20% are seeking help that are minorities.
It's a big problem.
Reverend Ray Whiteley,
preaching the gospel of the kingdom,
an organizer for Faith in Florida, is tackling the problem alongside Choi.
Using our churches as that safe space that they could come to and having conversations like these.
Addressing what he calls a stigma from the pulpit in the neighborhoods. And getting people into treatment, specifically minorities. How difficult is it?
It's been difficult because you have a lot of barriers that's stopping minorities from actually accessing treatment. One is the cost. Two is the stigma that's attached to what's happening now. We really have to talk about accessibility to mental health and drug addiction.
That accessibility and discussion is something the T. Leroy Jefferson Medical Society is taking on. The group of healthcare professionals focuses on underserved communities in Palm Beach County.
There's a stigma that exists. Sometimes we have to breach somehow when it comes to people of color, because sometimes you don't want to admit that there's a problem. Sometimes we take it upon ourselves. If you look at the numbers, it shows that their outcomes aren't as good as they could be.
Prevention, education, and knowledge through an opioid prevention series. Conversations with medical providers and the community outreach. They've created a website and toolkit for physicians.
I went to medical school a few years ago. We talked nothing about addiction.
Dr. Tiffany McCullough, an emergency physician, works with T. Leroy and believes it needs to be addressed on the doctor front as well.
So these days we think of addiction as a disease. Part of the problem is that if you don't truly understand that and you don't truly believe that, then you have a hard time living that and transferring that kind of information to your patients.
A newfound focus on solutions.
Once opioid problems became a problem for everybody, for the general population, and honestly for white suburban America, it became a bigger issue. Now it's a war on drugs.
We are seeing that people are responding differently.
We've done what we need to do to gain access to therapists, doctors that speak both languages, and so that's what we need to do as administrators, and Yeah, I mean, those things are major barriers that can be overcome.
And the states that saw the biggest percentage spike in overdose deaths: Vermont, West Virginia, Kentucky, and California.